Ladies and gentlemen, please find your seats. The ceremony will begin momentarily.
Good afternoon. Welcome to the School of Public Health Fall 2025 Doctor of Public Health Commencement Hooding Ceremony. Today we're here to recognize and celebrate the accomplishments of 3 graduates, Sika Dido, Ara J. Etheridge, and Aaron Stokes. I really want to extend my heartfelt congratulations to each of you, and I want to invite all of us here to recognize our graduates of 2025. Join me in applauding them. Admission to our DrPH program is a highly competitive process, and it requires a record of accomplishment and demonstrated potential to make significant positive impacts on the health of populations. Under the mentorship of faculty and through engagement with your peers in the program, you have honed your skills in areas diverse as data analysis, policy, and leadership. Being selected for admission into this DrPH program signifies your extraordinary potential. Your successful completion of the program means that you're now poised to be change makers in the field of public health. Perhaps now more than ever, your leadership is desperately needed. Today is a day to celebrate, to look back at your accomplishments with pride, and to look forward to the difference you will make in the lives of individuals and in the health of populations. But I would be remiss if I didn't acknowledge that you're earning your degree at a difficult time for public health. Over the past year, we've seen examples of the sidelining of scientific expertise. We've seen the elevation of practices that are clearly at odds with scientific consensus. And we've seen a deadly measles outbreak and a tragic shooting at the CDC that claimed the life of police officer David Rose. Times like these can really test our resolve. But the fact that our DrPH graduates are sitting here today, earning the degrees they've worked so hard for, is proof that they are prepared to meet today's challenges and those that will undoubtedly arise in the future. Like our DrPH graduates and many of the people gathered here today, I've chosen a career in public health because I'm convinced that the work we do changes lives for the better. In many cases, it saves lives. I'm also convinced that health is at the foundation of all things that matter. Investments in public health are investments in a more promising, more prosperous future. We measure our successes in freedom from disease and also in the flourishing that becomes possible when people achieve their full health potential. Our DrPH graduates are resilient and adaptable. I know this because if they weren't, they wouldn't be sitting here today. So as you prepare to earn your degrees, I encourage you to draw on your passion for public health and to apply your expertise to the very real needs of communities. Now is the time to lean into difficult work and difficult conversations. I believe that all people want better health for themselves, for their families, and for their communities. As public health professionals and leaders, you're uniquely equipped to turn that vision into reality. I'll close by reminding you that the world needs public health and the world needs you. Public health needs all that you will bring to it. May you go forward with purpose, with confidence, and with a commitment to the vital work of improving health for all. Earning a Doctor of Public Health degree is a significant achievement. You've made us all proud, and I know that you'll continue to do so in the months and years ahead. Please join me in applauding our graduates. At this time, I'd like to invite Dr. Harry Hyman, Director of the DrPH program, to the podium. Please join me in welcoming Dr. Hyman.
Y'all dressed up nice. Good afternoon. Come on. Good afternoon. There you go. Thank you. As director of the DrPH program, I'm excited to celebrate this incredible milestone for RJ, Sika, and Aaron. Public health continues to face formidable headwinds, as alluded to by Dr. Lin, and it often feels like we face them alone, but not today. I want to take a moment to demonstrate the power that we collectively bring to meeting this moment. And if you're joining us virtually, you can participate as well. So if you're a family member of RJ, of Sika, or Aaron, would you please stand up? And please stay standing. If you're a friend or a colleague here to celebrate with RJ, Sika, or Aaron, would you please stand up? And please stand if you're a School of Public Health faculty member or staff member or student here to celebrate with our graduates. And if you're not already standing, but you share our passion and commitment to public health and to assuring conditions for everyone to achieve their fullest health potential, please stand. And now, yeah, hard to know how many times you should stand, right? And now, RJ, Sika, and Aaron, I invite you to turn around and take in the moment and take in the movement that you are building. You are not alone. You are part of a powerful movement. Okay, you can now all take your seats. Thank you for that. In times like these, it's especially important to take notice of the community that surrounds us and supports us. And it's also important to take the time to recognize and celebrate significant milestones and accomplishments. Today, RJ, Sika, and Aaron, we are recognizing your amazing accomplishments. RJ, it was always clear that your interests lied in maternal child health. All we had to do was ask you. When you started the DrPH program, you were managing home visiting programs at HRSA, covering 6 states. Your project over the course of the program covered a range of topics, including refugee health, food access in low-resource communities, and you did an applied practice experience with the Federal Bureau of Prisons, of all places, recognizing that there were critical people there whose voices couldn't be heard, but whose barriers to being diagnosed and treated for sexually transmitted infections were ever present. Your passion, as you told us when we interviewed you, was in both diversifying the workforce and advancing breastfeeding practices among women of color. Your dissertation took a deep dive into understanding the many drivers of racial disparities in breastfeeding uptake, as well as a potential pathway for addressing this by diversifying the workforce of certified lactation consultants with programs housed in HBCUs. It should be acknowledged that in addition to your full-time work at HRSA and your successful completion of the DrPH program, in your spare time, you also completed your certification as a lactation consultant. You have stayed true to your passion and goals and are well positioned to provide critical leadership in this space. Excuse me a second. To get to a pocket with the tissue in this gown is challenging. Sika, you were working with HRSA as a public health analyst when you started the program, but your real dream you shared was to do global public health work in West Africa. You hoped that if everything went well, 5 years from now, after you completed the DrPH program, you would be able to shift your career. Needless to say, you didn't wait to complete the program to realize that dream. You started working in global HIV at CDC about 6 months into the program, and you haven't looked back. Since that time, your work has taken you across the African continent and beyond. Your APE was based in the CDC country office in Cameroon, supporting their launch of a pediatric surge focused on decreasing new cases of HIV for those under age 16. For your dissertation research, you focused on Senegal to gain a deeper understanding about the relationships between engagement in prenatal care, knowledge about HIV transmission, and risk of maternal child HIV transmission. Your research provided valuable insights not only for Senegal, but for other countries in West Africa and beyond. Aaron, yeah, it's your turn. Most people wouldn't recommend starting a new doctoral program while working full-time with a newborn during a global pandemic. But you did. And you thrived, though I suspect that family members might provide a more nuanced description. After your first year, I remember when Heather Bradley reached out to ask whether it would be okay for you to be a TA in her EPI class, because she was so impressed not only with your expertise, but with your ability to provide applied examples that students could relate to. Your APE not only highlighted your ability to support data modernization in the CDC Injury Center, but your recognition that there needed to be meaningful data science capacity building to ensure the necessary expertise to do this work. Your dissertation took this work a step further, as you demonstrated how generative AI could be used to both validate case definitions and identify cases not otherwise captured by routine surveillance methods. At least I think I got that right. But you didn't stop there. You stepped back from this work to assess the broader implications of AI to public health practice. You highlighted the need for public health expertise to guide these applications and highlighted the powerful ethical, privacy, and equity implications. RJ, Sika, and Aaron, you are powerful examples of what's possible when public health leaders combine their passion, their intellect, and their commitment to improving the public's health and advancing health equity. You give me tremendous hope for the future and our collective work to improve health outcomes and opportunities. When I began, I alluded to the formidable headwinds we face. Public health and the health of our nation and the world face unprecedented challenges from a political leadership that has gone rogue. It's critical that we speak our truths and engage our networks. If public health is about assuring the conditions for everyone to achieve their optimal health potential, we must spell out what that requires and share that message loudly and clearly. Social justice, health equity, and diversity, equity, and inclusion, these are among the fundamental values and goals of public health. These, together with freedom of speech and academic freedom, are the essential underpinnings of our training programs and our society. Ara J., Sika, and Aaron, you truly reflect the public health leadership that we need to meet this critical moment and to help ensure a more just and equitable future for everyone. As you continue your journeys, I'll quote Dr. Driffin, I urge you to be bold, I urge you to be courageous, and I urge you to be fearless. Congratulations again to each of you and to your families. Now for the most important part of the program, we're going to hear from our graduates. And I'll let you come up one at a time at whatever order you like, or make it easy, you can follow the order in the program.
Good afternoon. Wow, a beautiful audience. Thank you all for coming. Thank you all who are online as well for joining this occasion. It is so nice to see family, friends, Air J, Aaron, and myself. So let's start. I would like to first congratulate my fellow graduates, Aaron and Air J. We did it. We're here. We've arrived. This journey has not been easy. We've had challenges along the way, but we persevered. As Dr. Hyman shared, I started this program working with HRSA. I had an amazing supervisor, loved the job, but I always knew I wanted to work in that HIV/AIDS field globally. And within the first semester of the program, I changed jobs, closed out a house, a lot of transitions, but it all worked out. Everyone said, how are you doing all this? God. So I would like to also thank God. I feel like I wouldn't be here today without all of the support I've received from all of you and without my faith. Without my faith, definitely. Dr. Hyman mentioned that I travel a lot for work. At times I'll be gone for a week, 2 weeks, a couple months out of the country, but I still managed to complete this program. I just want you all to know that it can be done. Whatever challenges you're going to, you can do it. At times I was on the screen while my coworkers were online, and I was in different time zones, sometimes 5 hours off. Sometimes it's 11 p.m. at night, and I'm in class, but I made it happen, and I couldn't have done it without all of you all. So I will start in an order. Let me start with thanking my parents. I'll start with my mom, the first person to see me. Dr. Alon Detto, thank you. Thank you for showing me this can be done. You did this same thing with 4 kids and working full time. So I have no excuse. If you did it, I can do it. Next, Dr. Kojo Detto, thank you. My dad, his background is law, so he loves analytical thinking, he loves talking. I can bring an issue to him and he'll listen to me for hours. For those of you who play Uno, he's my draw 4 card. So if I'm ever in a bind, I know who to call. My dad is the problem solver. So thank you for always helping me problem solve. Thank you for being there for me. I'd like to also thank my other family members who are here in person or online. I have my nephew and my sister here, thank you. You all have been instrumental to this journey. A couple times my sister would call and say, just do it, stop complaining, just do it. And I didn't want to hear it, but I needed to hear it, so thank you. Next, I'd like to thank friends who are in this room and online. That also includes the cohort. We have been a community. We have done a lot of events together. We have been to each other's weddings, baby showers, you name it. This was a family. So I can call you friends, I can call you family, I can call you my cohort, but you are part of my life for life. I would also like to thank my committee. My chair, Dr. Ike Okusan, you have been amazing. Thank you for always checking on me. telling me, okay, come on, where are you at? There are times where I wanted to disappear, but you did not let me disappear. So thank you for staying on me. I appreciate it. Dr. Arumboa, thank you so much for your support, encouragement. I had the pleasure of taking an applied practical experience, a class with you, where you let me dive into topics that were of interest to me, and you guided me on how to explore different topics, where to find information, so thank you for that. I also have a chair, Dr. Lynette Emitewi. She is currently in Ghana, actually, so she's not here in this room, but she is bright and has been very supportive to me throughout this entire journey as well. I would like to thank my current coworkers and former coworkers. My current coworkers are amazing. I think I won the lottery for coworkers. They're actually having a watch party at work watching this. So I've always had amazing coworkers. Thankful for that. One of my coworkers flew in for my defense, actually, from DC. So I've definitely won the lottery for coworkers. So thank you all. You all have been supportive, and I could not have done this without you all. Lastly, I'd like to thank the entire community of people that I have. I love Zumba. I have my Zumba family. I'm part of several organizations. One is Iwaga, and I see you all in the audience. Thank you so much for showing up and for supporting. You all have been amazing, always checking on me. How are things going? I really appreciate you. I feel like I don't have any family in Atlanta by blood, but I have family in Atlanta by love, so thank you all. Let us see. Okay, I think I've thanked everyone at this point. If I have missed anyone, I sincerely apologize, but I think I crossed everybody off. In closing, I'm so proud of us, Aaron and AJ. I feel like we made this happen. It wasn't easy, but we made it happen. I can't wait to see what the future holds. I hope I read about it. I hope I get phone calls about it. I can't wait to see what we become. The world is in our hands. Things are not easy, regardless of regardless of any circumstances that we have. This journey teaches us that we can overcome it. Dr. Hyman talked about my dissertation topic. It is HIV/AIDS awareness and knowledge of HIV transmission, as well as antenatal care. And I was focused on Senegal, women of reproductive age in Senegal. And I really wanted to look into that because Senegal is actually a success story. Senegal has an HIV prevalence rate of under 1%. And I wanted to see what they're doing right and what other countries can do to replicate this. I learned a lot. A lot of it we know. Health is not just what you eat or how you're living. We have to look at the social determinants of health. We have to look at social demographic factors, socioeconomic factors. All of those impact our health. We all can improve health and well-being without addressing and mitigating those gaps and challenges. So in closing, I will say thank you again, once again. I look forward to what the future holds. Thank you.
Good afternoon, distinguished guests, faculty members, families, and friends. It is with great pleasure that I have the opportunity to speak with you all today. I want to give honor to God. He has truly kept me in his arms this year. 2025 has been of highs and lows, sometimes with me questioning whether public health was the right career choice. However, I know that God has a plan and I'm leading into my purpose. Congratulations to my fellow graduates on achieving this milestone in times of adversary. Each day you all choose to let science guide each and every decision to improve people's lives, both domestically and globally. Despite what people may say, this degree and public health in general is necessary in a profession that should be recognized. This ceremony marks the culmination of an academic journey over many years. From a very early age, I always knew I wanted to be a doctor who helped moms and babies. Now my dream of becoming a doctor looked a little bit different back then, as I wanted to be an OBGYN, but I found my niche in public health. Throughout my time at Georgia State, I purposely designed each class assignment and my dissertation to highlight issues African American women and women of color face every day as it relates to their health. Many of the policies and practices being eliminated have a detrimental impact on Black and brown people. As we start this new chapters of Doctors of Public Health, our charge is to ensure that the most vulnerable populations are protected and the disparity gap is not further exacerbated. We must continue to engage in meaningful research while working with other disciplines to create upstream solutions and interventions. As I conclude, there were many obstacles and challenges while matriculating through this program. I did not accomplish this goal or travel this journey alone. A number of friends, coworkers, cohort, my committee members, and family members who are both present today virtually and in person have supported me with their prayers, words of encouragement, a listening ear, and much more. You all poured into me and gave me extra support when needed. I particularly want to shine a light on my parents, Marvin and Sandra. You all made a number of sacrifices for Alonda and I to accomplish everything we set out to do. You were tough and no nonsense at times, but you raised us with love. Alonda, you are amazing. I could not have asked for a better sister. To my village, this degree is as much as mine as it is yours. I'll leave you with this quote. It sums up everything my parents and my grandparents sacrificed for me to be where I am today. What the trunk could not do, made the branches. Thank you, and congratulations again, we made it.
All right. Thank you, everyone that's here today. And I'm looking out. Where did my dad run away to? I saw the request for reflections, and I thought I would kind of just go off the cuff a little bit here. But wow, yeah, I can't believe it's been, gosh, 5.5 years now since I started this program along with the other members of the cohort of 2020. What an interesting time for all of us, and I think we're all a bit of gluttons for punishment on that choice. But, you know, I think deciding to return and get my doctorate, especially my doctorate of public health, was a very intentional decision. I received my master's degree some years ago, how many I won't say, but I really didn't plan on returning to school after that. And as I spent time working at CDC on different surveillance processes, in particular at that time before school and foodborne illness surveillance, you know, I really started to see a gap that maybe I could fill by returning to school. And the DrPH program, I think, is so unique, and I if anything, wish more people were aware of how awesome a degree it is, because it brings together the management and the leadership that is really sorely needed everywhere, but especially public health at this moment, with building on our scientific expertise. And I think GSU does that in a really particularly unique way. And as an epidemiologist by training, I really appreciated the opportunity to customize a program here that gave me those management and leadership and system thinking skills while still letting me build on my skills as an epidemiologist. In particular, thank you to the PhD staff who were very kind and allowed me to take some additional biostatistics courses outside of the normal DrPH program. It really just supported so many different things that have built me into where I am today. You know, I still look at humble leadership from time to time, Dr. Hyman. I think, you know, despite everything that has humbled us this year, we could always use some good reminders. But yeah, you know, it's been quite a number of years. I look out in the audience and my younger child, who, yes, I delivered the day after I turned in my application for this program. You know, I don't do things the easy way. She's now 6 as of a couple weeks ago, the age that my son was when I started the program. So I guess that kind of takes me into some of the thank yous that I especially want to make sure that I give to my husband Elliot and to my kiddos Indigo and Jackson. You know, I couldn't do it without you guys, even as you stormed my office while I was on Zoom classes more times than I can remember. You know, you guys also gave me a lot of positive moments in, you know, a really busy, jam-packed time. Because like most of my colleagues, I also worked full-time. While I sort of went to school full-time, I like to pretend maybe that second part was part-time, but that's arguable. You know, and also having 2 kiddos at home, one who, of course, was also on Zoom classes when all of this started. So I'm really appreciative of them. But yeah, I also want to make sure that I thank Dr. Strasser, my committee chair, but also my advisor, and also one of the faculty that interviewed me when I started here, although I don't think I'll be doing that JD you keep talking to me about. And then I also want to thank my committee members, Dr. Karen Nielsen and Dr. Cassandra Pickens, who's also a coworker of mine, and gosh, you all got me there somehow, and I cannot thank you enough. You know, this has been an extra special year for public health, to say the least. I think we've covered a lot of that, but you know, it's now more than ever, public health really needs leaders who can adeptly navigate both the scientific and the policy issues. And they're able to lead the public health field through this current moment. And I really hope that I can leverage my work and learning from Georgia State to do just that. Yeah. So again, thank you everyone, and congratulations to my fellow graduates today. I am just, I don't know, completely floored to be here. But yeah, we did it. Thank you.
Will the DrPH graduates please stand? By the virtue of the authority delegated to me by the President of Georgia State University and the authority vested in the President by the Board of Regents of the University System of Georgia, I hereby confer upon you and each of you the degree described in the official records of these commencement proceedings with all the rights, privileges, and responsibilities thereunto appertaining. You may move your tassel to the left. Congratulations. Can we give them one better round of applause, listeners? Thank you. All right. I now invite Denise Gavea to present the degree candidates.
Thank you, Dr. Lynn. And now it's time to individually recognize this year's graduates. Graduates, I will call you one by one, and when your name is called, please approach the stage with your chair, and we will proceed that way. So the first name, Dr. Sika Dado. Now we'll have Dr. Ira J. Etheridge. J. Etheridge, Dr. Era J. Etheridge. And Dr. Aaron Stokes. Congratulations to our graduates, and I will now turn it over to Dean Lynn.
Let's give our graduates one more round of applause. A big round. This is a day of recognition and celebration. Graduates, you've joined more than 2,000 School of Public Health graduates and over 300,000 Georgia State University alum. You and your friends and loved ones who've supported you along the way should be abundantly proud of your accomplishments. Graduates, you're now poised to make an even greater contribution to the critical work of improving the health of global and local populations. On behalf of the faculty and staff of the School of Public Health, congratulations. This concludes our ceremony. Please join us for a reception in the area to the left of the stage. All right, thank you.